These are challenging times, but we believe we have the capabilities, and you, together with you, we are raising the engagement bar in your markets, and every day we want to help you go faster. It goes without saying that leadership, as Toby said, is an unwavering commitment from the top, really are critical to making this get done faster and better. So I want to invite two industry luminaries to the stage to share with us their wisdom and optimism for all of this. Here comes Dr. Cosgrove. Dr. Toby Cosgrove is a cardiothoracic surgeon. I think all of you know him well, best known for his leadership at the Cleveland Clinic and previously the CT Enterprise at the Cleveland Clinic, and basically turned them from a great academic research center into a world-renowned destination. Dr. Marc Harrison is a pediatric intensivist, formerly with Intermountain, et cetera, et cetera. I don't need to say anything more. So,
Thank you.
Thank you.
Well, I'm delighted to be here, and particularly because Marc and I have known each other for more than 20 years, and I know him to be one of the most innovative leaders in healthcare. And so I am now in a wonderful position to ask Marc the tough questions. So Marc, let's start. We've just come out of COVID, and it's had a remarkable effect upon healthcare delivery. What do you think the changes are that has brought around this, what I now see as a watershed for healthcare delivery?
Right. Thanks, Toby. And look, I've had an incredible career from my perspective, and a lot of it really had to do with the doors that Toby opened for me. Under his leadership, the clinic was the most entrepreneurial and innovative organization that I could imagine. And for me, it was like a kid in a candy shop. So thank you very much. I really appreciate it. So COVID taught us a lot of things, and I think a lot of them really good things. We heard from Toby. I mean, I agree with her around why we've reached the inflection point. You know, financials are unsustainable, big people problems. We didn't touch on the behavioral health issues associated with the pandemic. I think the degree to which health inequities became explicit. Many of us have known that they were there and we cared about them, but they were in our face, and I think they caused us to change forever. On the upside, my goodness, what a privilege for all of us to lead during this pandemic. I hated the death and destruction. I loved the urgency and speed with which teams responded. It was for a person who likes results, who likes impact, it was the best of all possible times in a terrible time for society. And I think, Dave, you may have heard me say this. I don't know where you are out there in the audience, but now that I know how fast you can go, we're going to keep going that fast. And I think the ability to innovate quickly and implement, it has me very optimistic. That's the good part of coming out of COVID.
Yeah, I think one of the things we saw was a sense of we can now change things in healthcare. And we saw it happen very fast. But I'm kind of worried right now that we came out of COVID and we see this enormous financial stress on every healthcare system. And just incidentally, Cleveland Clinic lost $1 billion in the first 6 months of the year. And how do you think that's going to affect innovation and bringing new things to healthcare?
Well, I'll caveat your comments. I agree with you almost completely, and the numbers that Toby shared were stunning. Those of us that have engaged in population health are doing fine. It's not easy, but we're doing fine. So I think the Intermountain's operating margin in the first half of the year is hanging right around 4%. And a lot of it's because, what is it, about 1 million people we take full risk on at Intermountain. And so when you get the first premium dollar, you can actually be endlessly innovative in terms of how you actually keep people well. So I'll caveat it in that regard. I actually think this finally brings us to the tipping point for the digital transformation. We've known it's coming. You've always been fascinated. I've been fascinated by it. But now, all these distressed systems, unfortunately, it took a crisis and is taking a crisis, and now they got to go. And for those of us that can help, and by the way, I love what Pranay talks about. Unlike, and we'll talk about disruptors probably in a second, you're here to help. We know that health systems aren't just going to die. They're almost impossible to kill, right? They're like dandelions, like really long. But if you can help these people who actually the communities actually trust, that's magic. And I think that's the secret.
Well, we've talked a little bit about the tremendous shortage that are in healthcare providers, and that the providers are the key to the finances. I recently saw that there's going to be required to have 200,000 nursing graduates a year in order to meet the demand in the United States. We're just not going to have that. How are we going to do this? How are we going to attract people to be the providers?
Huge problem. I think it's multifactorial. So I'll play back something that you taught me, and it's about having people do practice at the top of their license. And in this case, I think it's going to be enabling through technology people who are relatively lay people to be able to guide folks through healthcare. So for instance, like community health workers in a population-based model are huge. And then it's going to be able to use lots of AI-powered tools to help things move faster. And we need to train a different flavor of person. I had the privilege to give, on behalf of Intermountain, $50 million to our chief competitor in Utah, the University of Utah, to create a population health scholars program. So we were subsidizing the tuition of these folks, and then Intermountain said they would hire all the people who got trained in a population health model and create our own pipeline, much as you did at the clinic, creating a medical school. Took a page out of that book, and so I think it's going to be a whole toolbox that it's going to take.
But a lot of this, almost every revolution that's happened, whether it's Henry Ford looking at assembly lines or farmers looking for tractors, it's always been new technology that has come along. And are we going to be able to develop our own technology?
Look,
let's stop and think. Look at all the, when electronic medical records came along, everybody in the world decided they're going to make their own. And now almost everybody's gone to Cerner or Epic.
Right.
And just realized they can't do it. Are we going to learn the same lessons?
So I know we happen to be in violent agreement about this point. I'm
a good straight man.
The arrogance of delivery systems to believe that they can do everything is really almost endless. So, whether it's food or couriers or your IT or you name it, but the idea that we can start companies, you all can start companies and identify the problem, hatch them, grow them, scale them, is just ludicrous. I mean, this is like what Pranay and folks like him do for a living. And they're just so much better at this. Now, this is where this idea of partnership comes in. Pranay, people like Pranay are almost never going to have the ability to understand operationally, clinically, how healthcare is delivered. You heard him say he learned and learned and learned. So it's magic when you take folks who actually know how to create companies and then pair them with organizations that really want to share what they can do for people.
Marc, do you see it happening first on the, if you will, the administrative side, or on the clinical side that you're going to see the technology come, or both?
Well, the doctor tribe, we are a difficult tribe.
Very difficult. Anybody who's tried to lead them can understand that.
Yeah, I think we've all had that experience, and they hate change. Actually, they love it when it happens to you, but they don't like it when it happens to them. So I think probably a painless way of doing it is hitting the administrative side first. I saw a great company, young company, a couple weeks ago. They can credential a physician in 30 seconds. So they figured out how to do the data scraping and accurately can actually credential, and it takes weeks, right? There's time delay and people, et cetera, et cetera. Imagine for those of you that have thousands of doctors to credential, I think at Intermountain it's about 7,500 or 8,000 doctors across the system that need to be credentialed. Boy, if you could do that each in 30 seconds, wouldn't that be great? So I think those are the kind of solutions that are going to be, easy and relatively painless.
Yeah, and I've seen companies now that can continuously measure all your vital signs and record them in the electronic medical record. And think about what that means in terms of nurse work.
Oh,
running
and
around
satisfaction, right?
No, not the manufacturer. How many times have you been awake in the middle of the night to get your blood pressure taken in the hospital?
Yeah.
And so I think that you're going to see it happen in both areas.
Yeah.
So, there's a lot of news right now that's going on around the country about how major corporations are getting interested in healthcare. Walmart, Amazon, the Google has had a run at it 3 times. Microsoft as well. Do those things worry you?
Actually, no, and they never have. I'm fascinated by them. And I think those are not a homogeneous group. The one that I'll really carve out is actually Walmart. So, and I know you're a fan of that company as well. I mean, that company evolved to help people who live paycheck to paycheck have access to high quality and to be able to afford it. And I think that's the approach that they're taking towards healthcare as well. I'll be very candid. I think Google wants to eat your lunch, and they'll tell you they want to partner with you, and then they want to eat your lunch as fast as possible. I think Amazon is, blatant about their ambitions, and I don't think people trust them the way that they trust traditional providers. I will say that they can be great partners, and I've partnered with every single one of the companies we just discussed. If you're in a payer-provider model and you can use them for the right parts of the care path, because they can provide, great access and they can provide affordable care, and some of the care is very, very good. I think almost all of them, and this includes most of the direct primary care companies as well, everything's great until you have something really terrible happen to you. So what are you going to do when you get cardiomyopathy? What are you going to do when you've got a cancer? What are you going to do when you need a heart surgery? On and on and on. And their interdigitation with those of us who actually really know how to take care of patients is really quite poor. So I don't think the health systems are going away. I do worry that unless you partner really effectively, that you're going to be left with incredibly expensive, extremely complicated patients who are going to be disproportionately poor. So I'll remind you that Amazon brought One Medical, right? Rich people, and happy to take care of rich people. We've always taken care of everybody, and it's going to be disproportionately weighted towards poor people, and it's not going to make it financially viable. So if you want to succeed, you're just going to have to change.
For my 2 cents, though, one of the things that they do bring to the party that is quite extraordinary is their capabilities in AI.
Yes.
And
Here.
And you're seeing right now DeepMind and OpenAI have tremendous potential for looking after the huge data sets that are out there.
That's where you partner. I couldn't agree more. And actually, I think a lot of health systems are making big mistakes in terms of trying to derive their own algorithms and drive them. I think it's a big mistake. It's a waste.
Well, what about private equity that has gone into primary care and is attracting a tremendous amount of attention?
So you hate to paint with too broad a brush, right? But PE wants to turn things in 4 to 5 years, and they want their multiples that they paid for far exceeded. I don't know how some of these are sustainable. I will say that the thing that I think a number of them are actually backing value-based plays, and I think these are smart people,
Yes.
and I think it may foretell a move towards value, because in general, these folks have been right about what they've invested in.
Yeah, and one of the things that I would just add is my personal feelings about seeing private equity come in and seeing the Walmarts of the world come, I think it's a wake-up call for us, frankly, as providers. And the fact that we have been pretty sedentary in our willingness to change over time. And now all of a sudden, the forces from outside are going to encourage that.
So you know what's funny, Toby, is that the reticence to change is all about the ego and self-protection of the leadership teams and providers in traditional healthcare. Because every single one of you knows what the right thing to do is. It's to keep people well. It's to figure out how to get paid to keep people well. It's to measure results and provide quality, which was always a mantra working for you. Why haven't we done this? Because there are a bunch of CEOs who are trying to kick the can down the road and just get to retirement without making meaningful change.
Retirement's not bad, by the way.
So I think that you're 100% right. The writing's on the wall now.
Anything finally you want to leave with these folks?
Thank you for taking care of all our patients. And the final thing is make sure you take care of your staff. At Intermountain, we lost more of our caregivers to suicide than we did to COVID. That's actually pretty typical across the country. And so please take care of the human beings who work for you.
Thank you, Marc. And thank you for the opportunity.